D.C. To my colleagues across the aisle, I appreciate the debate, but I have to say I thought we were going to try to fix healthcare, to address costs, try to fix the economy, get the country back on track. Isn't that what the promise of the end of the shutdown was when we came back into session? Yet here we are 1 week after the end of the shutdown, after a truly harrowing several days dealing with the Epstein petition. And what are you guys putting on the floor to eat up precious floor time as we're headed into the holidays? Bills to micromanage DC affairs, bills to open public lands and tribal sacred sites to oil and gas drilling, and a ridiculous political resolution that I heard your own members last night on the floor talking about, and they called it, quote, stupid and kind of crazy. Their words, not mine, but I don't disagree, so don't get me wrong. So after 54 days of the House of Representatives being shut down, all you guys really seem to have time to do is to run bills like this. And what I find particularly offensive is that on a week that we should be working to address the healthcare crisis in a bipartisan manner, you're trying to pass bills today that would undo local police reforms that our nation's capital put into place after George Floyd's murder to ensure that the people of this city are safe and that the justice system is fair for them. So if it's not clear, I'm a hard no on these bills, not just because I believe they represent congressional overreach and abuse of power, but because they will harm the people of our nation's capital. And also, and I think this is where the conversation needs to be had, if we actually want to address public safety and actually help the communities across this country who elected us to do this work, we need to be addressing real solutions. Addressing the addiction crisis, investing in behavioral health and addiction recovery programs, investing in diversion and community-based programs that help people who are hurting and living on the edge get back on their feet, investing in our children and pipelines for young people to have lives that they can only dream of, fixing a broken system that makes it difficult for people who are living on the edge to survive, to raise wages, to lower the cost of housing, of food, of energy, and healthcare. And yes, fixing the broken healthcare system that you all said you were going to come back and address. Because these are the systems that are broken and that are hurting our people, and especially in New Mexico. It's not just the cost of healthcare that's going up, but our hospitals and our clinics and our providers who are struggling to make sure that they can stay afloat, especially after the big ugly bill gutted and promised to take $1.5 trillion out of the public health care system. It's why I've been working to champion bipartisan health care and health solutions like bills to invest in urban, rural, and tribal health care, invest in congressional funds for building clinics, sponsoring legislation to address the fentanyl crisis, to recruit and train more nurses and healthcare professionals, to recruit more counselors to fix the Medicaid and Medicare system, to expand telehealth and broadband, and yes, to finally put this country on a track to universal health care. Because I believe that health care is a human right. I believe that access to food, water, and shelter and safety is a human right. I believe that justice and freedom and access to the criminal justice system is a human right. And I believe that basic dignity is a human right, which is why I implore my colleagues, stop with these divisive political tactics every day and these bills attacking our communities, and focus on the issues that matter, that the American people are asking us to, because that's why we were elected, and real lives are on the line. So let's get back to work on real issues. Stop attacking Washington, D.C., stop attacking our public lands, and stop attacking the basic dignity, and human decency of our communities.